So in medical practice, we always make use of codes. You come across a lot of codes. All right. Now this is because there's a need for the medical professional to be able to communicate with his colleague, and in some times, maybe in a coded way, you don't want anybody just coming across that information then knowing the information. So there's what they call the ICD-10 O codes. ICD-10 O codes. All right. So those codes are just codes that we use to actually classify what diagnoses related to pregnancy stuffs, birth stuffs. You understand? So we're just trying to look at those codes. Look at what they mean. So the O00, O9. Now note how they write the O and 0, right? O is more bigger than 0. So pregnancy codes include ectopic pregnancy, molar pregnancy, and other related pregnancy conditions. The O09 is supervision of high-risk pregnancy. So you just write it, So the other medical professional, when they have it, they should interpret and know, right? The O20, O29 codes, that's from O20 to O29. These are codes for what? Complication of pregnancy, such as all those hyperemesis gravidarum, where a woman is, vomiting too much, then gestational diabetes. So labor and delivery codes, they are from what? O60 to about O77. Codes within this range are for complication of labor, complication of delivery like preterm labor, fetal distress. The O80 is a counter for full-term uncomplicated delivery. Okay, so postpartum codes now, they are from O85 to about O92. There are codes for postpartum complications like postpartum hemorrhage, puerperium sepsis. So if somebody is bleeding so much after giving birth, the codes actually fall within this range. The O90 are complication of what? Puerperium. Okay. So other codes, we have things like O98, maternal infection and parasitic infections. The O99, other maternal diseases, and all of that. So these are the different ICD-10 codes. All right. ICD-10 codes that we might actually use in talking about pregnancy issue, childbirth issues, and all those puerperal sepsis issues.